I imagine many of you guys are more educated on the coronavirus, COVID-19, much more so than you were probably a week ago, as is the rest of the United States. It's most likely that kids and asymptomatic patients are carrying it, and they have mild symptoms or maybe no symptoms at all. And so they travel around, interact with friends, family, and that's why you see an exponential growth in the number of cases across the world. It's spread like wildfire, starting in China and then through Europe, and now it's made its way here, which we've expected. But I'll say that there's a number of things that have been taking place behind the scenes in the city, at the hospitals, at our hospitals. Hendrick, I know, has made many plans and already implemented many different things to try to mitigate this risk and slow the progression of the disease. It's a new virus, so none of us have immunity to it. And because of that, that's one thing that makes it so contagious and makes it spread the way it does. And until it goes through our communities and we develop immunity, then the best we can do is try to, a new term many of us have learned is flatten the curve. And I think we understand what that means. As far as the strategies being implemented at the hospital, all of those things are designed to make sure that we have adequate resources and capacity to try to be ahead of anticipated needs for our community. And again, like I said, those plans have been in the works for a long time, not advertised, but in the works for a long time and are being implemented actively. So I'll ask my fellow Abilenians to also be proactive and try to help flatten this curve. Things that have already been done, we've suspended schools. It's my opinion and several of my colleagues' opinion that we need to continue this suspension, most likely indefinitely, until we see how quickly or how this spreads in our community. Because as I said earlier, young kids, I believe, are probably the vector, the ones that are asymptomatic or mildly symptomatic. And when they interact, it spreads throughout the school kids, and they take it home. So that is a reason I'm encouraging that we continue to suspend the schools. We can all continue to social distance. I know my family's at home getting reacquainted, playing games that they haven't played together in a long time, and running out of movies to watch on the DVD. But social distancing also helps to slow this progression. Online services, as Mr. Hanna said, are available for a number of different things, not just city services, but there are other opportunities to utilize online services. And I would encourage our community to, as much as possible, use those and just try to minimize interactions that are unnecessary. Those are some of the things that our public can be doing. And then at home, or when you do go out and interact, we're going to have to go to the store to get supplies and necessary things that we need for our daily lives. But when you do, be mindful. You don't do what I did and walk up here and put your hands on the podium. A habit, but we're all developing new habits. You don't touch things unnecessarily. You wash your hands, and when you are out, don't touch your face. Simple things, simple measures that can make a very big difference to our community and to ourselves. If you have some mild symptoms, not sure but concerned, you're most likely safest and best off just to stay home. Treat yourself with the Tylenol, the ibuprofen, the over-the-counter medications. Again, mild cold, a lot of people, this tends to be like a mild cold. And we don't necessarily go to our physician's office or seek medical attention when we have mild disease. I would encourage you to consider the same. If you're having more symptoms, more severe symptoms, and feel the need that you need to be evaluated, call your physician's office first. Reach out to them and say, hey, I've got fever, I've got this, whatever your symptoms are, and let them remotely help guide you to the proper area or procedure that needs to take place to make sure that you are evaluated and taken care of. Again, our goal is to flatten the curve, and we can all work together to try to do this. We want to limit our social interactions and do our best to work together and try to be understanding in what's going on and some of the measures that are being taken. I'd encourage everybody on this issue. We need to think globally but act very locally. And I thank you for your time.